Gynecomastia is a condition where men have swollen, enlarged breast tissues. Men with gynecomastia naturally feel very conscious and awkward about their body. This can sometimes make them feel upset and angry. But do they really need to feel so left out? Is there a solution? The good news is that gynecomastia has a very straightforward solution. A simple surgery can help remove the extra breast-like growth and allow men to enjoy normal life.
Many people come to us with this confusion that doc, whether there is gynecomastia or I just have fat. So an easy way to do is I ask them to pinch that tissue, whatever they have, right, on their chest with one hand, and with the other hand pinch your abdominal tissue. So you most of the time you'll feel that the hand which has the chest tissue is harder and the abdominal tissue is softer. So that softer one means it's a fat, and if it is harder one on your chest tissue, that means you are holding a gland and it is just as fat. And if it is there, then that means that you have gynecomastia, and it is not just fat. This is a very, very important surgery for one's own self-confidence, It's not like that patients don't wear tight t-shirts, they don't feel confident, they have a droopy shoulder so that the chest doesn't become prominent, but also that they don't go for swimming and don't go for beach holiday. So understand, this is a very important aspect for an overall personality development. So it is very, very important for one's own psychology and social well-being. The way we do it, that the patient comes in the morning, get his surgery done, and after a couple of hours of observation go back home. It's like a daycare surgery. They don't need to be in hospital overnight. So what we do is we make very small tiny scars of 4 millimeters only on the sides of the chest and not on the front. We use devices like micro air and Vaser. Now essentially what they do is they break the gland into small pieces so that we can remove the gland through a side small cut only, and we can avoid any cut on the front of the chest or around the areola. This is very, very important because they want a flat masculine looking chest but not with a scar. With this side port incision technique of ours, the person doesn't have any social stigma after the surgery that they have had a gyneco surgery done as well. You don't want them coming out of swimming pool and the person saying, have you had a gynecomastia? So that is also taken care of, because those 3-4 millimeter scars almost fade away very nicely over the next few months. There is no big scar on the front of the chest. Okay, so surgery is painless because it's done under anesthesia, and even after the surgery, patient is relatively comfortable because these technologies have made the procedure relatively traumaless. There is no tissue trauma, so the recovery is very, very fast. Patient can resume their daily activities from next day. I say that avoid gym for first 5 days. After 5 days, they can also do gymming. So such is the recovery period.